We're now going to look at the effect of changing the minute volume on the end tidal value for the expired CO2 from our anaquin model. The whole concept of the anaquin model is that CO2 production in an animal, be it a dog or an elephant or a horse, is at a constant rate, particularly when they're anaesthetised and lying on a table at a constant temperature. So we have a constant CO2 production within the body, and if we have a constant CO2 removal from the lungs, we'll have a flat level of normocapnia. Anything that disrupts either the delivery or removal of CO2 is going to change the end tidal value. So in this anaquin now that we've got ventilated, we have a minute volume of just around 3 litres per minute. That's 15 breaths a minute at approximately 200 mils per breath. With that condition, we have an end tidal CO2 of 43 millimetres of mercury, which would be quite normal for an anaesthetised patient. I'm going to change the respiratory rate now to increase the minute volume from this patient, and our prediction would be that by so doing, with a constant production of CO2 from an animal, if we increase the minute volume, we're going to see a fall in the end tidal CO2 value. So I'm going to go from a minute volume of 3 litres a minute, as shown here on the screen, indicated by a respiratory rate of 15. We're going to change the expiratory time to turn this up to maybe 4 litres per minute or 4.5 litres per minute. Let's go to there, 22 breaths, 4.3 litres per minute. So we've increased our minute volume by approximately 33%, and we should start to see, as we can see on the screen, a reduction in our CO2 output. So our end tidal has now fallen to 32 millimetres of mercury, 31, and it's sort of levelling off at that point. This is purely by an increase in minute volume. We've done nothing else. We haven't changed any of the characteristics of the anaquin. And if I were to increase that respiratory rate a bit more to maybe a rate of 25 by reducing the expiratory time, then we now have a minute volume of 4.67, and our end tidal should fall a little more. Now we've fallen down to end tidal of 28, 29. And the process is reproducible. As we continue to increase the respiratory rate, our end tidal value will continue to fall as the minute volume is increased for this animal.